Why is this tough guy in his 50s considered tough? Just look at him. He's always like this. He's a coach. His professional career might even be worse than mine. He uses a bed, because there are many doctors, and these doctors really need it. The people who benefit most are patients who are bedridden and can't get up. How do you help relieve their pain? For some people with back pain, even lying down doesn't help. And then he can't get out of bed. His knee pain is so bad that he can't get up. So it's all about positioning him properly in bed. All right. Teacher Wang mentioned it wasn't this guy acting as the horse down there yesterday. Yes, after acting as the horse, didn't his thoracic kyphosis improve a bit, right? It improved a bit. So now we need to see if there's any rebound. Before I leave, let me tell you, you need to observe how his thoracic kyphosis straightens out. If he does high pull downs or rows like this, overworking the muscles responsible for extension, it will make his back too straight. In this situation, you need to relax those muscles. The muscles responsible for extension loosen up. That way, even if he pulls, the effect won't be as pronounced. And when you train the muscles in the front, there's a chance the kyphosis will return. If this person's issue is that the diaphragm is stuck in the lower position because it's stuck in the inhalation phase, then during inhalation, the thoracic spine is extended. After I finish training him, if during exhalation he doesn't have the ability to push his diaphragm upward, then the problem would definitely rebound because his diaphragm remains positioned too low. Because from the time we finished training yesterday until now, he has already taken about 20,000 breaths. With 20,000 breaths, you can think of it as 20,000 extensions of the thoracic spine. If each time the movement is more about deepening than returning, then has it fully returned to the state before we trained yesterday? Or has it only returned halfway or just a third? Actually, it's just the difference in this aspect. Now, let's take a look. All right, till you head back. Okay, this one hasn't really returned to the original state in this area. This is restored. It hasn't completely eased up, only partially returned the thoracic spine extension. This one is all right. Now, what else? Let's look at the rightward rotation of everyone's thorax. This one is also much better than yesterday, right? I want to take a look at that young lady with the congenital ankle issue, the 35-year-old. Come on, she's actually quite remarkable. Why? Because she was born with her foot turned out like this. And then she actually used the muscles to hold it in place. And surprisingly, she didn't develop severe compensations. If it was someone more fragile, their spine would have been badly twisted long ago with serious scoliosis. So what does this show? It shows that her mental state is very healthy. She's positive and upbeat. She hasn't been defeated by pain or illness, and she hasn't given up the fight. If she had given up fighting, she would have just let it get worse. So you see, her facial features are also quite regular. And her spine doesn't have any obvious scoliosis. So that's pretty good. Okay, hold your head and squat down again. Let me take a look. He hasn't fully recovered yet, has he? Yeah, she hasn't fully returned to her best state. Yesterday, she was able to squat down to 90 degrees. So that means her ankle is affected by her breathing by at least 50%, at least more than 50%. That's why she hasn't recovered yet. Yesterday, I mainly worked on her breathing. And then her innate ankle condition itself also plays a part in affecting her. Originally, she could only squat down to about 15 degrees, not even 30 degrees. She couldn't even squat down while standing. So that's why a lot of people ask me, can just taking a couple of breaths really help you hold the position? Well, look at the two of them. Didn't they manage to hold it? Isn't it much better than before they practiced yesterday? That's right. That's good enough. So let's keep practicing. Now let's see which ones you still have left. And then you do one. The gentleman's cross-leg pose with the right leg. Gentlemen, this is for women. Students, you'll notice that you can't lower it down. Usually, most people can't lower their right leg when doing the gentleman's cross-leg pose and can't cross their left leg over when doing the ladies' cross-leg pose. It's usually like this, doing the ladies' cross-leg pose on the right side, right side, right side. You'll notice that you can lift it up like this, but when you open it, you can't lower it down because the right side is internally rotated. All right, now do the ladies' cross-leg pose with your left leg. It won't go down. So now try sitting with the gentleman's cross-leg pose on the side. Isn't the right side a bit better? So what does this test? This tests the internal and external rotation of the hip joint. Let me check your Thomas test. Lie down here. Yes, just do it once. And don't open outward. Keep it in this position. All right, let go. Thomas test, not good. Yes, that's a positive Thomas test. Now the other side. Neither side can go down. Teacher Wang, if you're filming, make sure to film right in the center. That's at the other side. Look. All right, that's good. Have you ever had any injury to your right leg? Have you ever had a fracture?
No, I haven't.
Do you know why it's so straight? He's a soldier. He served in the military, so his posture is always upright and rigid. So actually, our soldiers need to learn how to breathe the most, because after standing in military posture all day, they need to use breathing at night to adjust and recover. He's actually fine. Let me check if there's any misalignment, like if the left side is lower and the right side is higher, he's okay. All right, I'll help him get into position. You just lie down here. Take off your shoes. Hey, wait a moment. Go test your lung capacity first. Just now, we only had him lie there and breathable. His lung capacity have increased. Bite down on the mouthpiece. Actually, I'm making adjustments while he's lying on his stomach now. But ideally, we should compare his lung capacity when he's lying on his side on the bed before and after the adjustment, right? But my cable isn't long enough. I can't put it over there. It doesn't matter. After he has adjusted it while lying down, he will also feel better when he stands up. In a bit, after we measure his lung capacity, I'll ask Teacher Wang to come up and help palpate him to see if there's any misalignment. Then, after we finish the breathing test, we'll have him palpated again to see if this has helped with any misalignment, because this is quite meaningful for him. And also, let him come over and have a little sparring match. All right? His best result is 3,909, just under 4,000. Okay? Just lie there. It's free. I've invited the master to do the palpation for you. We'll mainly check the thoracic spine, lumbar spine, and pelvis, and also take a look at the cervical spine while we're at it. His palpation skills are very accurate just by touching. He can even tell your fortune. Do you often get migraines on the right side?
The right side feels tense.
Do you feel any numbness in your left arm?
The left arm not numb.
Does it hurt here? Does it hurt here? Right, it doesn't hurt here, does it? Do you usually sleep on your stomach?
Well, it seems he doesn't sleep on his stomach, but his neck is significantly twisted, which means...
Rotation, misaligned.
Yes, it's a major twist. It likely happens when he exerts force. His whole body is twisting.
Don't adjust it. Just feel it. Just palpate. Because he has an occupational habitans. He feels something out of place. He wants to fix it.
Does it hurt here? Huh? Do you usually feel palpitations or chest tightness? Huh? Do you wake up easily at night? Besides being straightened, his upper thoracic around T3 and T4 is slightly misaligned. Cervical vertebrae, C2 and C6.
Both C2 and C6 are misaligned, so it's the second and sixth cervical vertebrae.
C2 here, C6 left, right.
Not C2 to C6, C2, C6.
He's got a twisted neck.
I see. Let's also check the range of motion of the cervical spine in a bit. Just now, we only checked the thoracic spine, not the rotation of the cervical spine. Which leg is longer? Hey, don't pull.
Come on.
Yes, he has one leg longer than the other.
Right. This leg is longer.
The left leg is longer. The right leg is shorter.
It's here that hurts, right? Is it like this? This spot is okay, right? Here, this spot is sore too, right? But this spot isn't. Okay.
All right. Tell everyone which misalignments he has. And then you can feel around again in a bit.
What I felt is that there's a misalignment on the right side of his second cervical vertebra, then there's another misalignment on the left side of his sixth cervical vertebra. Also, the area above his left clavicle is a bit full, and his third thoracic vertebra is tilted to the left with a depression between the third and fourth thoracic vertebrae. As for the left hip, when we feel it, is twisted backward, and this left leg is the longer one, while on the right side is twisted forward. Everything else is fine. In the middle section, aside from changes in the curvature and the alignment of the articular surfaces, there are no anterior, posterior, or lateral deviations.
Okay, well, that's good. I invited someone up here to demonstrate. Come down, turn your neck a bit, because we haven't checked the rotation of your cervical spine. Now, let's observe the rotation of his head and neck. Turn to the right is restricted, right? Now turn to the left. Yes, as teacher Wang just mentioned, on his left side, there's a torsion between C2 and C6 in the cervical spine, right? So this will affect his rotation. Let's see, after he finishes this exercise, if there's any improvement. All right, let's begin. Normally, all the range of motion tests we just did for you were done while standing, right? Actually, it should start with tests done while lying face down and lying on your back, then standing. After finishing, you test again. That's the fair way to do it, because you were tested while standing. But I'm having you practice while lying face down. Practicing face down really only addresses issues that occur while lying down. But that's okay. If I don't have enough time to help him adjust everything, we'll just work on the face down position and see if it works. Now I'm going to help him make some adjustments using my method, and we'll see how it goes. All right. Now just relax here and breathe. Naturally, don't deliberately pull in your stomach. You don't need to worry about anything else. Just exhale slowly. Just breathe slowly. I didn't adjust it completely. If I adjusted it, it wouldn't be straight. It's like you adjusted it electrically, but it still wouldn't be straight. Let's just keep things natural and give it some time. So what exactly are we doing with this approach? I've given it a name. Give time, some time. Let the past be the past. Do you understand what I mean? Yes, give time, some time. Let the past be the past. Just give it some time to breathe and let the vertebrae that need to settle. Do you get it? So being a professional is boring. You have to find joy in the midst of hardship. Usually, I have members starting in the prone position. Do you know why? Because the movement behind the diaphragm is greater than in front. And also, for most people, the thoracic spine is straightened. So after working on the back, I have them lie down. But lying down doesn't necessarily mean you have to blow up a balloon. I'll have time to explain this to everyone later. For new members, if they can avoid blowing up a balloon, then don't have them do it. Blowing up a balloon requires meeting certain conditions before it can be done. This is to increase the intensity for them. After that comes the seated position and then the standing position. This is the whole set there, are just these few: prone, supine, seated, and standing. That's all. As for the rest who leave, it will be difficult. Let me say it again. The three-point alignment is only for people who sit for long periods, not for those who are active, especially if your exercise intensity is high. The more intense, the less stable it is. After the adjustment, it's meant to keep you still, not moving. But if you want to be both active and stable, what should you do? The only way is through training. Let me tell you again. If you want to improve someone's breathing, the less you intervene, the more you actually help them. What does that mean? It means you shouldn't artificially press, stimulate, manipulate, pull, or massage them. You should guide them to practice slowly. Only through this kind of training will the result be the most stable. The more external force you apply, the less it relies on their own ability. So our greatest strength as humans is our self-healing ability. Breathing is the same if I can leave it alone I will leave it alone. Take bone setting as an example. When do you go from being an enthusiast or hobbyist to an expert and then to a master? At the level above master, it's not that your movements become more and more precise, but that you move less and less. It's when you can achieve the desired effect without even moving. That's when you've truly reached a higher level. For craftsmen, the competition is about who can move more skillfully, who can find a better position. That's what craftsmen do. But at the highest level, the real competition is about who can achieve results without moving at all. That's when your skill reaches an even higher level. All right, that's it. We just had a little chat. I haven't tested the others yet. Let me test the Thomas test first, since the range of motion for Thomas is the largest. Okay. So is there any improvement by any chance? Yes, try another one. Is there any improvement? Let me tell you. The most effective training for positioning in the Thomas test is breathing while lying face up. I haven't had time to train him yet. It needs to be practiced lying down, because the Thomas test is done lying down, not in the prone position. It's fine. I'll teach him the lying down version in a bit. Next, what else are we going to look at? It's the rotation of his neck. Just now, when he turned his head left and right, wasn't it restricted? I didn't touch his neck. Come on, try rotating to the right again. Is there any improvement? Okay, now rotate to the left. Any improvement? All right, now let's look at the rotation of the thorax. Is there any improvement? Rotate to the right. Is that okay? Then go and test your lung capacity. And let me see. It's over 100 more, right? 4,056. What was it just now? 3,900. 09. 3,909, right? So it's over 100 more. Okay, I won't urge you the second time. Come on, go lie down. I'm going to start the second one now.